All right, Dr. DeCubellis here. I want to go through these motion x-rays so you know what we're looking at. And we're going to look at the lumbar or lower back. That way you know what the motion looks like there. I wanted to start by actually showing you a normal. So let's go through here. This is of a patient that we took, and this one ended up being normal. So this is the right side over here. You see the big R. Spine's in the center right here. Vertebra, just like this, nice and big square. These circle things you see in the center, those bumps you can feel in your back, the spinous process. This is one hip, this is the other hip. So what we're going to do is we're going to have them bend side to side. We want to see how everything moves. We should see the vertebra kind of pinching on the side they're bending toward, opening of the disc. This is the disc space right in here. Opening of the disc on the side they're bending away from, and then these spinuses should rotate to the side they're bending toward. So let's go ahead and see how this looks. So they're bending to the right. See how these have rotated to the right? There's pinching. They bend to the left. These rotate to the left. There's pinching right over there. So when they're over to the left side, we can see that we've got pinching compared to this side. So the space is narrow over here, open at the side they're bending away from. The spinuses have rotated to the side they're bending toward. When we go back to the other side and compare it, we can see that as they're bending to the right here, all these rotate to the right, pinching, opening over here. That's what normal should look like. So now that we know what normal looks like, let's take a look at what abnormal looks like. So same thing here. You can see we're already off to a bad start. This person is already bending over to the left. Let's see what happens biomechanically when they start to bend. All right, so right now they are bending to this left side. You can see you didn't see much of anything. Now this one's starting to bend a little bit, but look at the spinous, didn't move whatsoever. Now they're going to go ahead and bend to the right. They're bending to this side over here. You can see this spine did not move. This rotated, the spinous rotated a little bit to the right, but there's absolutely no movement to this side whatsoever. Big difference from the other one. So these are the things we looked at, because when we know that this is happening, not only do we know that the person's having pain, and their pain is on this right side, right in this area, now we can see that biomechanically their body's not allowing them to move to compress this area. So we've got muscles over here that are going to be firing more to kind of keep pulling them this way, as you can see by the slanted spine. And we can see that this hip over here, even when they're bending, it doesn't allow this hip and this spine to get closer together. A lot of dysfunction going on here, but this really tells us exactly what we need to do to get this person better, because it's not about just getting out of pain. It's about fixing the problem. And if we restore proper biomechanics, then we'll make sure that this doesn't come back.